to it, right? Yes, we're ready. Well, thank you all for coming tonight. It's a pleasure to be here. Because we have this lovely intimate space in this gorgeous room, I first want to introduce myself. My name is Jill Kaplan. I'm a licensed clinical social worker, and that's my phone texting about probably a basketball game. Yes, they won. Sorry, that's the parent side. Hello, come on down. I'm an oncology social worker. I've been in the field for 35 plus years, and right now I am the program director at Cancer Support Community. Have done a lot of work with programs involving children. Mostly, if not the majority of that work has been on helping children whose either parent or family member has cancer. So this program is going to be directed more towards that versus the childhood cancer. So the way I like to present is I have some information, but I don't know that that's what you want to hear about. So it would be helpful for me to find out what brought you here and what you want to know, so I know that I'm covering it. I'm also not a stickler for let me talk, you don't get to ask questions. I'd rather have a dialogue. It makes, I think, for a more informative type of discussion. This is a difficult enough topic, and I commend any of you to come out here, especially the parents. Sorry, I know you're a parent too. Because this is a tough topic, and I'm sure that you'd rather be someplace else than addressing this. So I, again, commend you for coming. I also want to introduce my colleague, Catherine Schreiber, who's just going to tell you a little tiny bit about Cancer Support Community.
Sure.
Which is where we're from.
So my name's Catherine. I'm a program coordinator. I'm also a licensed social worker at Cancer Support Community. Just a little bit of background of what we do and what the things we address as an organization. We're a lovely little nonprofit organization located in Bedminster, part of a larger national network of affiliates. And we cover really all across central New Jersey into northern parts of the state, addressing the psychosocial, emotional needs of all people affected by cancer. So that includes patients along the continuum of care, from diagnosis through survivorship, as well as caregivers, family and friends who have loved ones diagnosed with cancer, and bereavement support as well. And anywhere from young little people, children, who we'll talk about today, to adulthood. So we provide really a variety of different support programs, all free of charge to the community, from support groups to health and wellness classes, different nutritional programs, educational workshops, not unlike this one tonight, on-site, off-site, and sort of as an extension of what we have been doing traditionally, we're really implementing a lot of, putting focus on support for families, for young families like yourselves with children involved, and taking the show on the road. We offer school-based support groups, so going into the schools, meeting the children where they're at, providing them the support around the challenges of having cancer impacting their family in any way, as well as educational workshops like tonight. Am I missing anything?
Social programming.
Sure. So in terms of support for families, there is a support group component as well as the education, but we can also, we're expanding on just some of the fun activities, social activities that we can provide for kids or family members, or both, adults and kids together. It's a really safe place for people to come together, like-minded people, like-minded challenges, to just be, for kids to be kids, for families to be families in a really safe and confidential space.
We are not a clinical setting. We are a barn and a farmhouse, an old farmhouse. We have a ghost. Usually he behaves, doesn't come out when the kids are there, just when the adults are there. But it's a different type of atmosphere. One of the social events that I would like to really push tonight, we're having a cupcake challenge, a cupcake wars. For families and children. We want to bring kids together who may have cancer in their life to be around other kids who talk about cancer a little bit, but then also talk about the Patriots and the Eagles, and they talk about midterms coming up, and they talk about, I'm a Giants fan, so I get it. I'm sorry. I can say it, but when the kids are around, I can tolerate it. So we'll talk about that, but we'll also bake cupcakes, or we'll bake cookies, and we want to get the family involved as well. So that's some of the social programming we do. We've had baseball games.
Movie nights, I mean, you name it, we've got it going on, really.
That's good, yeah, great, thank you. Okay, so, like I said, I want this to be as informative as possible, so it might help me, if you're comfortable, just sharing a little bit about either what brought you here or what you're most interested in hearing about. Anybody want to be the first brave soul to say that?
Sure. Okay. I'm definitely here because the little girl in the school has cancer,
Okay,
and my daughter is very involved with her.
okay,
So I'm just trying to figure out the right ways to support my daughter and support the family and not do too much overexposure to everything too. So I'm just kind of
okay,
trying to gauge where I should be.
perfect, thank you. Same.
That's pretty much the same. My daughter's also in her class, also a friend involved. I'm involved helping the family. My daughter had a very tough time in the beginning of the school year to the point that she was having panic attacks. Anxiety didn't come to the first day of school. She actually had passed out when she saw her for the first time in a hospital-like setting. It threw us off. So she had a very, her reaction was just very physical.
Almost traumatic.
Yes.
Traumatic experience.
Yes, so she is in her class and she's kind of adjusted to how it goes, and they have that robot in the classroom, and it seems to, but it's kind of, what does the future bring? How to help her through things that might be down the road or that kind of.
Thank you.
It's all the same stuff.
All the same stuff. Okay. Anything you want to share?
No, pretty much the same.
Just here.
I'm interested to see.
Any of the faculty want anything specific? No? Just Giants, you want to hear about the Giants? I'm sure.
I mean, I know the same concerns that they brought up are the same that we've heard from time to time, so.
Okay.
I was going to say some of the basics about cancer, educating us about cancer, what happens when children, they respond, what happens if I become sick next, will I catch it, what's going to happen to me, can you get sick as a parent, I don't want to die, having nightmares and anxiety based on that, and so those were a couple.
Okay. So I think what I'm going to just do initially is just give you a little overview about cancer. I'm going to say something global, and I'm sure that this does not resonate in this room because this is why you're here. But childhood cancer is actually fairly rare. We tell that to the kids that we work with whose parent has cancer because it's a very common fear, I'm going to catch it. And while nobody can predict the future, it is just it's not the most common cancer, and it's also a very treatable cancer. Having said that, there's no way that I can tell a child, don't worry, this will never happen to you, don't worry, it will never happen to me. We can never make those kind of promises. We have to be able to phrase it in a way that a child feels safe enough, but we're not putting out false hope, or that we're not godlike people that can predict the future. So I haven't done a lot of work with pediatric cancer, but I've done a lot of work with kids. Kids are resilient, and they're narcissists. The two together actually make for, well, not for us as parents, but for them in their life, it makes for a pretty good set of coping mechanisms because it's about them. When there's a crisis or a change in their life, they become a bit unstable, but they do want to know and have some basic needs. So let me just tell you a little bit about crisis points in cancer. And this can go for the child as well. Maybe the maturational level or the cognitive development level might be a little bit different. I don't know that children confront their own mortality in the way an adult does, but kids do know that people die from cancer, so if I'm diagnosed with cancer, it could be there. There is often a movement from denial, like this isn't really happening to me, I have a sore throat, this really isn't something that I'm going to need chemotherapy, I'm going to lose my hair, I can't go to school. People typically go from denial to a constructive processing of information. The more information that we have, the more I'm able to process it and internalize it and act upon it. Which is why we say no matter what the age, spoon feeding information to the child in an age appropriate way or the adult in an age appropriate way gives people a tangible thing to hold on to instead of wondering and worrying about the myths and misconceptions. There's often a reorganization of life around the crisis of the diagnosis. So you guys were talking about this child was diagnosed with cancer and everybody sort of rallies and their life, the family's life was interrupted, but it sounds like the school's life was interrupted, the student body's life was interrupted, the parents' life was interrupted, because it is a crisis. It is a traumatic experience, not unlike 9/11 or a Holocaust. It may appear differently, but it really is a crisis. There's often a change in self-awareness, self-perception as healthy to ill. Now for some children, I worked with a child once, she had heart disease when she was younger, and then when she was probably about maybe 8 or 9, her mom had cancer. She had a really hard time with the attention being put on her, on the mom, instead of her as the sick child. She was no longer sick. The majority of people do not get a lot of secondary gains out of illness, but it can happen. There's the management of fear and anxiety. There's the initiation of treatment and psychosocial tasks, which is understanding treatment. So a child needs to know they're going to stick something in my IV or a port. They need to know what the plan is. At this age, they certainly do. Maybe a young child, an infant, a 2-year-old, maybe a 3-year-old may not know. They have to be able to incorporate the emotional demands imposed upon themselves as well as the family. So if all of a sudden I'm having a temper tantrum because I can't be at Rockstar Day, I have to go to the clinic, or I'm the parent and I can't go to my son's softball game because I'm at treatment center, it's going to impact me. So there's so many emotional challenges that are placed upon the family as well as the patient. I think the management of fear and anxiety goes throughout this. Kids are a little bit less expressive about it. Maybe they're going to express it through behavior. They may be a little bit less verbal about it. Adults typically are more aware of it, may act out upon it, or may actually verbalize about it. There's also the planning for anticipated side effects, and there's side effect management. I don't know in her case if she's experienced side effects, but there's side effects for physical body image, hair loss, skin changes. If there's surgery, there could be surgical scars, the inability to eat or taste or sleepy, fatigue. There's so many different side effects that treatment and or the disease can impact. So if she was an active child and now can't run the length of the soccer field like all of her friends, or like she used to do, there's a question, who am I, even at a young age? I don't want to spend that much time on the actual treatment. There's also an issue when we talk about some of the services that we provide. We look at cancer along the continuum. So there are issues from the time of diagnosis. There's a treatment plan, there's treatment, there's side effects, there's completion of treatment, there's survivorship, there's recurrence for those that a cancer may come back, and then there's also end-of-life issues, terminal illness. And throughout all of those, along that continuum, there are issues that can come up, and we want to be able to acknowledge them. And the family and I would call the friends and support as part of that network, goes through something similar as well. Just because someone has completed treatment and they're now in this survivorship mode, there's a whole host of issues that come up, which is, it could be resentment, it could be anger, it could be fear, it could be worry, it could be hypervigilance, it could be, I lost all this time, now I'm going to be a little reckless. It could be so many different things. So for the child, and I guess when I'm thinking about the child, since the parents are here regarding your child, there's an emotional response that children go through their psychosocial development. Again, this is Piaget. I don't need to go into a whole lecture about psychosocial development, but ever so briefly, when children are like in the infant stage, they go from basic trust to, versus mistrust. 1 to 3 years old, there's a psychosocial crisis. There's autonomy versus shame and doubt. They still need instruction and support to continue gaining control over bodily functions. The genital, 3 to 6 years old, initiative versus guilt. And we're dealing more from the latency 6 to 12 years old. Is that more? Okay. Yeah, that's what I want to talk about. It's industry versus inferiority. They learn from others as well as self-exploration. So there's an encouragement for opportunities outside of the home. That's where all of these team activities and Girl Scouts and Boy Scouts and clubs, that becomes incredibly important. Friendships develop outside of the family. Kids start having best friends. They start exploring and developing an expanding world, which for the typical child, that's pretty safe. You put cancer into their world, that's not really on the horizon. That's not the typical child's experience or parent. So for the child with cancer, it certainly isn't expected. The child whose friend has cancer, it kind of rocks their world because that's supposed to happen to old people, right? It's supposed to happen to grandma, maybe an aunt and uncle, but they're old. It's not supposed to happen to anybody else. Latency age children also have healthy self-esteem. Adolescents, you're not there yet. God bless you when you get there because it's challenging. Yeah. Oh, you've already been.
We're there too, but that's different.
Yeah. Okay, that's another whole topic, and I'll be in the audience with you. All right, so the basic needs of children when a parent is ill or a friend is ill. I really believe that these can coexist. They want information that's clear and understandable. So if we start using all this medical jargon, like we're going for an MRI and it's going to determine the histology of the nuclear invasion of the white blood cells, they don't really need to know that. They need to know things where you're going to use language that is age appropriate and things that apply to them. So if I'm going to go for an MRI and my insurance company is giving me a hard time and it's going to cost $10,000, my child does not need to know that my friend is going through this or I'm going through this. All they need to know is I won't be there to pick you up after school, Mrs. Smith is, because I have to go for this test. There's no reason for them to know that there's a financial concern. That's an adult issue. Some of the other needs, they need to feel involved and important. And in this situation, it sounds like these children have done above and beyond things that I've heard of before. But even if there's an adult who's sick, children want to be able to feel included but not burdened. So there's a difference between, okay, you really need to go and take your friend trick-or-treating because you know she's sick. Well, maybe I want to be with my other friends. Or, Dad's not feeling well today, so could you miss and skip your Friday nights out with your friends to be home with him? Well, maybe one of Dad's buddies can come over instead of the child. Maybe the child could do something with him on a later date on their normal time. Kids want to be reassured about the reactions of adults around them. So, if I get bad news of some sort, and I'm on the phone with a friend, and the tears are coming down my face, and my child is sitting there looking at me, Mom, what's wrong, what's wrong? Oh, nothing, I just have a piece of dust in my eye. Do you think that they're going to trust me that I'm telling them the truth about things? They're really not. We need to be able to reassure them that I'm crying because I just found out Grandpa had a heart attack and it makes me sad. Now, I can't tell them what's going to happen to Grandpa unless Grandpa died, but Grandpa's in the hospital, everybody's taking care of him, but I really want them to know that crying is appropriate for this reaction, this situation. It's okay to cry. If I start kicking the dog because I'm angry that the insurance company's not paying my MRI bill, Mom, why are you kicking Charlie? Oh, he didn't eat fast enough. That's not the truth. Now my child is kind of wondering why my behavior may be different than the situation. Kids also want to know that it's okay to have their own thoughts and feelings. So I think sometimes as parents, we think we're supposed to protect our child from those like not so nice feelings, the fear, the sadness, the worry, the disappointment. Actually, no, their feelings no different than ours, so they just need to be able to have them and for us to give them the tools to normalize them and to just try to support them, but we can't take them away. It's part of life. So if they're scared or upset or panicky about this happening with a child or a parent, there was a gentleman I worked with many, many years ago, and I remember he had 3 young children, and one became very somatic. I think he had a colon cancer, so the child kept having stomach aches. I can't go to school, I have a stomach ache, I can't eat. And they were so smart, they took that child, was a little boy, to the pediatrician. And the pediatrician already knew that this child was feeling this, and the pediatrician had a conversation with him about cancer. This little boy was thinking he's getting cancer because that was his thought. Physician told him how rare it was and reassured him, but honored his feelings and his thoughts, not to say, oh, don't think that way. I mean, we as adults don't want to hear someone say, oh, don't feel that way. Don't think that. Adults all the time in support groups will come and say, this is the place you all understand me, because when I go home and I say something like, I don't know, I'm really scared that they're going to find out this treatment's not working, someone in their life might say, well, don't say that. But that's how I feel. But don't say that. Well, okay, it's a scary thought, but it's really my thought. And children need to have that same opportunity. Kids also need to maintain their own age-appropriate interests and activities. I would imagine that some kids who are really close to a student who's ill might feel a little guilty or a little sad about, I can go do these things, but he or she cannot. I think it's really important to be able to validate their feelings, but also encourage them that it's okay for them to have their own needs met, because that's basically what life is about. Perhaps they can find some other things to do that also include the ill child, just like if dad, I worked with a gentleman who was on a treatment where he could not be exposed to the sun, and the family was planning a vacation to the beach. He made the decision that he did not want to sit up at the deck all day long. It was making him miserable. He was going to stay home with a long-time buddy coming over and spending the week with him. He knew that's what he needed to do, and that he needed to have permission, and gave his family permission, go to the beach, because I can't do what you're doing, and it would make me more upset to feel like I was burdening you or I was keeping you down. Really, what kids want to know is that they're going to be taken care of. So let's say there's a child who's ill or an adult that's ill, and one of the parents of another child is saying, well, I'm going to go take care of him, or I'm going to bring food over. They really want to make sure there's food for them as well. It's really nice and kind to be always feeding the family on Wednesdays at 7, but if your family's always had pizza at Wednesdays at 7, it's important to really maintain some of those traditions as well, because that's their life. That's their routine, and there's nothing wrong with that. As a matter of fact, they want to know that they're going to be cared for. Any questions? Just stop me if, okay. So, why do we tell children? Why do we talk to them? Why do you think? Why do we even have to talk to them about this rough stuff? It would be really a lot nicer to sweep it under the rug until they're maybe 17, and they don't have to hear about some of the tough stuff.
It's because it's part of their life, and they're dealing with it. If you don't talk to them about it,
Then what happens?
they're going to find out from somebody else.
Exactly. And when they find out from somebody else, there's a broken trust, and there's also a sense of, well, we don't communicate. We want to do the opposite. We want to foster trust and communication. Years ago, I was developing a program at a hospital I worked at on how to help your children. It was coping with cancer for the child. And there was a gentleman in the community whose wife had an advanced breast cancer. The children didn't know this was a recurrence. They had no idea that she had had cancer to begin with. They did not tell the children that mom had now stage 4 breast cancer, which in her situation would likely lead to her untimely death. They asked if I could see them, just to assess, what they were thinking. But remember, they didn't know anything about cancer. They were 3, 5.5, 6, and 7 or 8, something to that effect. The 3-year-old didn't come. The dad brought the 2 older girls, came into my office. We're sitting there chatting, drawing, adorable girls. So what's going on at home? Well, Mommy has cancer. Really? How did you know that? One of them told me that her best friend, sitting on the bus with her, told her because her mom knew. And then the older one told me, I'm telling you, this is going back 20 years, but I still remember this as if it was yesterday. The older one told me that she heard Daddy and Grandma talking on the phone. Okay. Well, what do you think about that? I don't know, but I see Daddy crying with Grandma. So what do you do? Well, sometimes I get scared. And the little one says, when I get scared, I go to my sister, all 7.5, 8 years old. And what do you do, 7.5-year-old? I hug my pillow. Now it's time to bring Dad in. So Dad comes in, and girls, is it okay for us to tell Dad what we were going through? He almost fell off the chair because he truly believed they knew nothing. So if they had gone through life like that, or this situation like that, never knowing Mom had cancer, I'm not sure that they blatantly would say, oh, I don't trust my dad, but not that it's easy for parents. In some way, it's easier not to have to deal with some of those difficult things. It would be more pleasant to sweep it under the rug. So we tell them so that they can confront their own fears about illness. You described it exactly, a panic attack, or just a fear and a worry.
Well, she asked me if she could catch it. It actually came out on the first day of school. When after an
It's
attack,
so
she
common,
said,
and
I know you told me I can't. Like I had told her already.
maybe she didn't hear it.
But she said, but why? She wanted to know why she couldn't. Even though I had told her she couldn't, she wanted the explanation.
That's a great question. Well, I can catch a cold,
Right.
right? I can catch, it's like we call, Mommy's taking medicine. Mommy lost her hair. So when my doctor tells me you're taking medicine, I'm not taking that medicine because my hair is going to. So they want to know specifically. We say you can't catch it, or wash your hands, we don't want to catch. That's perfectly concrete and totally logical and wonderful that she could say it. That's exactly why she brought it up, because she trusts you enough that you're going to communicate about that. We want to tell them so that they are able to be educated and that they know getting information is a really helpful thing. Mastery. Unfortunately, we have to help them with mastering something that's pretty obnoxious, but mastering that I can get through this once I learned more, hopefully once I became more comfortable. And there's magical thinking. I can catch this. But there's other magical thinking like, well, I invited Josie to my birthday party, but I didn't invite Sam. Now Sam gets diagnosed with cancer. I must have caused it. I must have caused it because I wasn't a good friend. That's magical thinking. Well, if I don't know they're thinking that way and I haven't conveyed all this information, then they're walking around with that kind of information. That's why we tell them. Myths and misconceptions, we're responsible as adults for being able to tell them what's true, again, in an age-appropriate fashion. We don't want them to develop mistrust, and sometimes if you tell a child something that's not exactly clear, or they hear it from somebody else, 2 + 2 ends up equaling 5. So they have complete misinformation, and they hear something from the little girl sitting next to her. Well, yeah, your mom has cancer, and you know what? My grandpa died last year of cancer. So now I have a 5-year-old who found out from her friend that her mom has cancer, who she did not know mom had cancer because mom, dad, nobody told me. And now her friend's saying, and my grandpa died. So clearly your mom's going to die, right? Because 2 + 2 = 5. That's why we talk to them. Kids have fine-tuned antenna. They pick up on things we don't think that they're hearing when they ignore us, and they hear it all, but they don't have enough information to be able to interpret it themselves. That's why we tell them. We want to make sure we know what their needs are. So, how do you know your child has experienced stress maybe from one of these crises? How do you know?
Trouble sleeping?
Trouble sleeping? Somebody said something before about you have panic attacks, somatic complaints, right? Withdrawn, all of a sudden they're quieter. Absenteeism, I can't get to school. Regression, that's when it's pretty severe. Poor attention. Isolation, aggressiveness, incomplete assignments, irritability, tearful, this sounds just like a 15-year-old, attention-seeking depression, a labile affect, and could be defiant. That doesn't mean that when your child displays this, which they are going to at some point, that it's all about something that's going. It could be a sign of stress. Okay. How do you tell children about this cancer? Has anybody ever had to talk to their child about cancer?
Yeah.
Okay. What'd you do?
This situation.
I'm sorry?
This whole situation.
So what did you do? How did you tell him or her?
Well, she knew that the little girl was having back pain. And she knew that she went in for surgery. And then I sat her down and I spoke to her and I told her, you know, Katie has cancer, and what that means is she's going to start getting treatments for it. And all we can do is support her and be kind to her. And
Okay. Okay. How did you tell your child?
Pretty much
Same
the
thing? Okay.
same thing, yeah.
So we talk basically about a couple of things. Be honest. If they ask you a question, you know that favorite question?
questions came right with that.
Is she going to die?
Or do we know anybody who has had cancer and died?
Okay, so what do you say?
I brought up situations that we knew people with cancer who did not die.
Okay. What happened? What would happen? Cop out, but I would do the same thing. What?
Just had to reverse it.
That was before this program. What would you? So what's the worst that you think would happen if you mentioned Aunt Tilly who died at 76 from breast cancer? What do you imagine would happen if you told her that?
Well, she would be okay because they were old.
Okay.
She would handle
What if there
that.
was somebody young who died of cancer? What's the worst that could happen to her and you?
To her, she's a worrier.
Okay.
She would start relating everything to, is this cancer, is that cancer?
Okay. Okay. So as a parent, we have to be prepared to be able to deal with that because, and I didn't mean you copped out. I think it's a very.
I'm fine with it. It got me through it.
But if a child says, can someone die from cancer? What's the answer?
Oh, well, no, you're right. I said yes, people can die of cancer.
Okay.
But then I gave her
The
the positive right with it.
But that's okay. It's when people say, no, that only happens to people that live in another state. It never happened to New Jersey, or it doesn't happen to people at this age. That's because that's going to be the worry. Same thing.
Mhm.
Can I catch it? No. people don't catch cancer. Do other kids get cancer? They can. We can't give promises that we can't answer. We need to use the name, cancer, because they're going to hear it just like those two little girls heard it, cancer, as opposed to she's not feeling well, she has a bump, she has a little bump on her, well, for a child, she has a blood disorder, she's not feeling well. It's really important because they're going to hear it from somebody else. I think it's also important to encourage questions. You're riding home from school, how was school? Anything come up about anything? You can always come to me. If you can't come to me, go to the nurse. Go to, a favorite aunt or an uncle. But to always encourage that, and I always say the sillier or the stupider the question they think is the most important one. Like, can I catch it? Or, I found hair in my brush. Does that mean I'm losing my hair because I was next to someone that had treatment?
How about defining cancer for elementary age children?
So, so a doctor taught me this years and years ago. Of course, I dropped my pen 300 times earlier. Okay, pen. So, I cannot draw. That's cancer. What's this picture of? What's different? That is cancer, the square.
The square.
The square is cancer. That's what he did. He said all of these things are cells, but this square is the abnormal one. That's cancer. And so when that abnormal one gets bigger, or there's others, it doesn't let these round ones do what they're supposed to do. My art drawing. And it truly works because kids then were like, oh, I get that. It's abnormal. It's not supposed to be there. Does that make sense? Okay. Use age-appropriate language like, boo-boo. I had a young girl once who was walking around with a doll, and she had a Band-Aid on the doll's breast because the parent said, Mommy has a boo-boo right there. It's okay. Talking with your child, sharing and modeling feelings. If you're sad about something, I'm really sad about what's happening to Joey. It really bothers me. Well, why? Because I don't want to see him go through that. And I especially don't want to see his parents go through that. It's really sad. And it's okay. Totally okay to cry, I think. Prepare the children for expected side effects. Now in this situation, the side effects and or changes have already happened. But should you ever have to explain that to anybody else, if you know what's going to happen, let them know. Grandma may lose her hair from this, or grandma may be having surgery on her tongue. You might hear her sound a little funny, but it's okay. So to be able to explain that to him. Respect a child's need and coping style. Kids may laugh. Doesn't mean they're being disrespectful. If that's the way they've always been, that's the way they've always been. If your child's having a reaction of some sort that doesn't feel like, I don't want to say normal, but is not their norm, then obviously it's important to address it with the schools, any kind of outpatient treatment, play therapy, speaking to your pediatrician. There are programs that help children process kind of this cancer experience through education, information, being with like-minded kids. We have a program at Cancer Support Community called Kids Connect, and kids come together who either have a family member with cancer or someone who's lost a family member. And it was the holidays, and we were making cookies. I had worked at another hospital where we had a kids program where every week was prescribed. This one was, we're baking cookies. I'm like, well, what's the curriculum? We're baking cookies. Okay, so I made a batch of dough at my house for my daughter and I to make, and I brought the cookies into work, and we're rolling out the dough, and the kids are yapping about holidays and songs, and Justin Bieber, I don't know, they were yapping about stuff, and I brought all these cookie cutters from, you know, Kwanzaa, Chinese New Year, Christmas, Hanukkah, you name it, it was there. They made sunshine, rainbows, stars, a couple of snowflakes, a couple of snowmen, a couple of little, that's what they were thinking at that moment. Their ability to just process their hopes and their dreams through cookies, I learned a big lesson there. This is just a closing statement that I said many years ago at a conference, and I think it's very, very, very appropriate no matter where you are when there's children and there's some kind of crisis. The presence or absence of an explanation can affect how a child makes sense of an illness. Programs and the opportunity for children to be able to express themselves provide kids with an explanation about the illness. In a social setting, school, outpatient, the child's situation appears less irrational, less unacceptable, and more understandable because they're with like-minded people. So that's my formal presentation. I don't want to go on and on and on. I would like to know if you have any questions or anything specific. I know that there were things that you had brought up at the very beginning. I don't know if they were answered, and if not, please let me answer them individually now. Here's one. Do you have a question?
Do you have a question? How do you know when to balance it out when you're giving to the family, you're giving to the child in need, and then maybe, you know, you have to refill your own well? At what point, like, what are the signs or signals that you...
Signs or signals of myself, you'll know them. It's sometimes resentment, you know, that I can't get it all done, or I'm overwhelmed, or I can't get to my own family to make dinner because I'm running to somebody else. You know, feeling a little burdened, even though we want to be able to do something, we actually can't be all things to all people. Catherine, I know, has even taught me, I've been in the field the early years, she's, you know, relatively new about self-care. And really, in order for us to be caregivers, we have to be able to take care of ourselves. We are not mind readers, so there's no magical way for me to say, I think it's when the family does such and such. I think it's important to ask them. There are many times when families are so blessed by their community and they get an outpouring of food and whatnot, then I'll hear, I'm so sick of chicken. I'll hear, there's so much food in my freezer, I don't know how to tell them, hold off. Sometimes not bombarding a family, but having liaisons. So let's say this family is so blessed to have this community help them. If there's one or two people who can be liaisons to say, okay, just checking in. How are you doing with the food? Okay, there's a lot in your freezer. Okay, we don't need so much food right now, but her two other children need rides. It's asking. Because for a lot of families, I don't want to be a burden, I don't want to ask. Sometimes they don't even know what to ask. One final story, many moons ago, a family member of mine, an uncle, was diagnosed with cancer, and my mom called me to say, I spoke with them, and I said to Aunt so-and-so, you know, if you need dinner, just call me, or if you need something, call me. And I said to my mother, what were you talking about? Oh, I wanted to make dinner. Well, then why didn't you just say that? I'd like to make you dinner. I don't know. Call her back. She called my aunt back, and she called me back, what are you doing on Thursday? I'm bringing dinner. Because when the patient or the caregiver, I'm thinking of the adult patient, feel the burden of now I have to help you navigate what I need, it's exhausting. But if there's one or two people that can help them and find out honestly, all right, what's the need this week? And the needs change. It may totally change. It's a new season. It could be, I have to get my daughter cleats and I can't get there. Could you take them? It's asking. I think it's asking and not thinking we have to mind read, because we can't. You guys had some specific questions, I think, about your children, and I'm not sure if I got to them. Was there
I
anything?
think a lot was answered. The one thing, your programs, are they more so geared to kids that have parents or siblings or not necessarily friends going through treatment? Or do you ever do anything for friends? See, I feel like September, October was a big time. And there was a lot of questions, a lot of changes occurring. And I think that's when the kids were feeling very anxious. And now I kind of feel like it cycles, you know, at least with my daughter and from a few other people I've spoken to. My daughter's in class with the child, so she knows when she's calling in and she's feeling good, and she knows when she's not calling in and she's not feeling good. And she kind of gauges that to when she reaches out to her. You know, she's like, well, I can reach out because I know she called in today.
Wow, that's exhausting. She has her own life to live, and now she's sort of gauging.
Yes.
So it is.
It is exhausting.
I think to answer your question, so we create the programs.
Okay.
So other than my executive director saying, no, you can't do that, we can kind of almost do what we want. So the first, I know we had talked before we were doing this about other kinds of programs. I am so not opposed to individualizing a program for the kids. And it could be, it's just to sit around and let's talk about this. It's not a lecture. It's not that if they have questions, you got the cancer experts, psychosocial people. This is what cancer looks like, not necessarily or combined with a nurse. So the program that we're talking about is primarily for, I'm not sure, you can speak to this as well, I'm not sure that they would benefit as much but that doesn't mean we can't individualize something for children here that would be of benefit.
Well, and again, I don't know when the need is, because it definitely, I see it flux in my own house, you know. At one point she was starting to get stomach aches, and I hope it's nothing like. And I said, well, that's why we go to doctors, and that's why we do these things. We have to, we always following and making sure, and that's what her family was doing. So I think it changes.
We can also be a resource. So if somebody says, oh, my child continues to be somatic, and you call one of us and say, hey, you know, could I bring my child there? Just sometimes they need a one-shot little reassurance from someone who's not a scary doctor, not wearing a lab coat, not, you know, the principal. No, it's something totally unrelated. Use us as a resource.
Okay.
You can call, we have our cards, call us. If it's something individual, if you find that there's a group of people that are saying, oh, it's coming May, or if there's a change, or let's say she got scan results and they needed to extend some sort of treatment, and now the kids are hearing that, but they don't understand it, bring us, we can come in. As Catherine was mentioning, we have school-based support groups. You know, we do a one-off. I think we're in the community, we're a resource, and
That's good to know.
use us.
And you might want to think about, too, just thinking about how, I know it's still a few months away, but what their exposure to their friend will look and feel like once the summertime comes. Because it sounds like there's this cohort of kids who are in her class are seeing her face to face whenever she feels good enough to chime in. And so there might be some changes in behavior too that might, I don't know, just not wondering how her friend is doing. I don't know if you're able to see her in person or anything over the summertime, or what those boundaries are, but that just is coming to my mind in terms of how to cope with that change.
I think that that's a conversation to have with the parents. You know, how many of these children see her outside of school? Not every child does, but if they're friends, it may be that the parents are saying, oh, sure, this is our summer plan. I think it's a good point. For some kids, it just may be out of sight, out of mind. It really depends on the relationships with the kid. There's no right or wrong way to deal with that. Again, I think parents, family members, whether it's of a child or an adult cancer patient, it's a lot of work for them to say, I need this, I need that. They may not know. But if someone has a relationship and is comfortable enough to say, hey, I'm thinking about, you know, at the end of the year barbecue. Can she come? Well, the first 10 days after treatment, she's neutropenic, she can't come, but it can be on this day. And if you have the ability, have it that day. That's something that's accommodating for her and the parent, because now the parent can give her something that's normal. It's a lot of communication. And it's hard, I think, when you have a community that wants to do so much that it can be overwhelming to a family who kind of wants a little bit of privacy, but appreciates the help, sometimes doesn't even know who the help is. I think when there's a liaison or two, it just makes it a little bit easier for everybody who wants to help and who needs the help. I don't know if that makes sense, but it can be overwhelming to navigate all the wonder that comes out of the community as well. Questions?
I think I'm good. Well,
There's nothing
There's
good
never
about
good,
this
but
topic.
yes, yes.
I've often said I would love to not have a job in this field. I really would. But I know back when I was this age, nobody talked about cancer. So the fact that we can talk about it, the fact that we encourage children to talk about it. All right, one more story. In the program that I used to do at a hospital system, we had, it was like an 8-week program, and the kids were in one group and parents were in another group. So it was the issues around parenting when there's children, the issues around parenting when there's cancer in your family versus the kids who were dealing with cancer in their family. And we had activities for the kids, and the parents would have their activity. Licensed mental health practitioners were doing this with the kids. It was an art therapist and one of us. About the 7th or 8th week, there was a loss. One of the parents died unexpectedly. I'm like, oh, great. So they called me to tell me, and now I had to call and let the parents know. One of the worst calls I've ever had, because all the parents were like, oh my God, no, you can't tell my child, you can't tell my child. It was their worst nightmare that was going to happen to someone in their family. Brought the kids together, told them, they made all these cards. I will never forget it. I was in Nantucket, and I had all the cards, and I was mailing them from them because these kids said, you have to mail them this weekend. Fast forward another week, the father, the well father, was a very shy, quiet man. And he called me to say, Chris wanted to come back for this particular session, which was when the parents and the kids got together and did this family bingo night and a couple of other activities. And I was like, okay, so now I have to call that group of parents again. No, oh my God, we can't have them come back. We want them to come back, we don't feel, but my kid's gonna be upset. It's really the parent who's gonna be upset. Bring them back. I kid you not, I have a photograph, I have to bring the photograph the next time I do this, of me in this room of parents and kids. And so let's say that's your child, you're sitting next to her, you're sitting next to your child. There was one family, a dad who had 3 children, and his son was closest in age to this little boy, Chris. So they come into this conference room, and Chris sits down, and the little boy with the 3 siblings says to his dad, can you move? And he sits down next to Chris, I kid you not, and put his arm right around him. 8 years old. The picture of me is against the wall. The tears are streaming down. They were so resilient. He wanted to help that child because he just did. Had nothing to do. The parents were like, no, we can't go down that road. We can't. The kid was resilient. It's a true story. I do need to bring those photos in. Next. So, thank you for listening. Please, again, my card is here. Our brochures are up on top. If you didn't sign in, I appreciate it if you did. We have lots and lots of programs that go on at Cancer Support Community. Come visit us someday. Hopefully you won't need a lot of services, but we have a really pretty outside garden in the springtime.
Do you guys do a walk in the fall, or?
We do a walk in June for National Cancer Survivors Day, and we do a butterfly release. If you get your name on our mailing list, you'll hear all about our programs. We have a lot of mind-body. In my mind, you've been affected by cancer, so you can come down. You can come and see what we do. We do things like Reiki and yoga and my cupcake challenge that no one is signing up for. Please all sign up for my cupcake challenge for your kids. Nobody has signed up for it. You please? Nobody has signed up for it. It's such a great idea. We thought it was a couple of weeks ago. Yeah, it's like cupcake wars. Let's do cupcake wars. And we thought, yeah, that's so exciting. Let's put it on our calendar. And the only person that signed up is one of our participants who's a personal chef.
That's why no one's signing up.
They're winning.
That's why no one's signing up.
No, she's only allowed to be a judge. We told her that. Her cakes are like perfect. And, no, she can only be a judge. Thank you for
All right,
coming.
thank you.
And pat yourselves on the back for actually coming and listening to this. This is not easy.
Thank you.
Thank you.
Thank you.